This is Marianne Cahill, and I'm presenting my capstone mini paper number 4, Early Diagnosis as Intervention of ADHD, ASD in African American Children. This is for the Contemporary Social Work Integrated Approach, Professor Carol Ann Daniel at Adelphi University. This is a social service program, and it's entitled Every Child Matters. This program is designated to correct the problem of the lack of early diagnosis and intervention of ADHD and ASD in African American children. Attention Deficit Hyperactive Disorder is ADHD, and Autism Spectrum Disorder is ASD. This program utilizes the services of a specifically trained multidisciplinary team. This team will help to diagnose and then implement early intervention programs. This is for toddlers, infants, preschoolers, grade school, and pre-adolescent children that all come to the Hudson River Health Center in Beacon. Many of the patients that come to the health center are African American, and a very high percentage of the patients begin their medical care as newborns through the prenatal clinic. Because the children are already at the clinic, it is easy for the staff there to implement the Every Child Matter program, and they will assess the children for ASD and ADHD. And this will in turn ensure that there's as many children as possible that are receiving early intervention. The program services include, at a clinical level, the multidisciplinary team creates a comprehensive assessment. It states the clinical, psychological, and social aspects of a child's current diagnosis. All the members at the clinic and of this team are specially trained to recognize, assess, and diagnose ASD and ADHD. There is a sensitivity training that is received by each member of the team. And the nature of the exposure, because of the cultural diversity of the clinic, will help the team members to have a better understanding of the behavior of African American children, which allows them in turn to have a more accurate diagnosis. There are other disorders that can be misdiagnosed as ASD or ADHD. Some of them are iron deficiency, lead toxicity, nutrition deficiency, food allergies, sleep and sensory disorders. Early assessment and intervention at a clinical level will allow children to be able to begin early treatment for ASD and ADHD. This also will rule out any treatments of any of the disorders that were listed, because these disorders are commonplace in children who live at or below a poverty level, and that is the client that comes to the clinic. The multidisciplinary team that works with the pediatrics will consist of one physician, one physician's assistant, a nurse, a nurse's aide, and one psychiatrist. There is also 2 licensed clinical social workers and 2 social work interns that are a pivotal part of this team. They all work together to do a physical screening of the child so they can rule out any physical or medical criteria that could be misdiagnosed as ASD or ADHD. The licensed clinical social worker by using the DSM-5, can also use that tool to assess if they do indeed have ASD or ADHD. By using the DSM-5, they can also rule out other disorders such as defiance disorder, which is often misdiagnosed for children who in turn actually do have ASD or ADHD. Once the members of the team have done their individual assessments of the child, they will meet and then they make a comprehensive assessment. Once they've finished that, the licensed clinical social worker and the social work interns will now meet with the parents or support members to discuss and explain the assessment. Now the parents or support members of the child have a recognized cohesive profile that they can carry forward and use it for the academic career of the child. Once the child is assessed and diagnosed by the multidisciplinary team, that's when they implement a treatment plan. Part of the treatment plan will include weekly therapy sessions with a licensed clinical social worker at the clinic and at least one group therapy session facilitated by the social work intern at the school or at the clinic, depending on the age of the child. Any of the children's family or support system members that would like to be included are definitely encouraged to participate. There are skills that are focused on in these treatments. Some of them are coping skills. There are some limited cognitive behavioral therapy trainings, and there is an emphasis on how parents and support system members can advocate for the children by emphasizing the strengths of the child when they are placing the child in a school or a social setting. There are CBT trainings for parents that show them how to become co-therapists for the children. They work with the children to change the behavior, and by doing this, they become experts on their own children. At this point, they can now look at the treatment and focus on the problems that have been defined, and then they can now have the power to terminate the treatment when they feel the child has developed successfully. Some of the coping skills that are taught are for the family members as well as for the child. Being able to deal with educators and medical personnel who are not trained or who do not have cultural competency this is a very important skill for children with ASD and ADHD and their family and support members as well. There are many biases against African Americans in the educational and the medical system. There is a great lack of African American educators and African American members of medical professions, and there are misconceptions over what is an acceptable behavior in a school setting for children. So African American children must work very hard to get an education that comes easier for their counterpoint. There are several New York state and federal laws that regard educational requirements for students with special needs. The Section 504 of the Vocational Rehabilitation Act of 1973, which is a civil rights law, this prohibits programs that receive federal funding from discriminating against children with disabilities, and in certain circumstances it requires school districts to make accommodations for children with disabilities, including ADHD students. There are several federal laws. One includes the Individual with Disabilities Education Act. This mandates that eligible students get access to special education and related services, and that they're designated to meet each child's unique educational needs. These laws will also allow for grants And these grants are used to fund programs that are specifically for different children with different needs. Some of the funding is specific for African American children with ADHD or ASD. These grants would include the Center for Disease Control, which is the National Birth Center for Birth Defects and Developmental Disabilities. It's called the Project to Learn About Youth and Play Healthy, which is Play MH. This regards students with ADHD and how the disorder affects the community and how treatment intervention helps children and the community. The next grant is the New York State Health Foundation and is specific to the Hudson River Health Center in Beacon because it's a specific program. It's specifically for the study on assessment and intervention for African American children with ASD, ADHD. The next grant is given to the Every Child Matters program, is from the No Child Left Behind federal study. This is presented through the City of Beacon School District to the program. This is a Title I grant. It's specific to the Beacon School District, and it comes through the United States Department of Education. This program includes the salary for one licensed clinical social worker who will work in the school district of Beacon to bridge the program from the clinic to the school district, and it allows the licensed clinical social worker to attend all CSE meetings for the child, to be there when there's assessments for ADHD and ASD as far as what the child will need for services. The last grant is given to the program from the National Public Health Practice and Resource Center for Children with Attention Deficit Hyperactive Disorder or Tourette's. This is just a one-time grant, and it's given to funding centers that have the capacity to develop and provide health promotional programs and health communications and educational resources for professionals and the public regarding ADHD or Tourette's. One of the main indicators of the success of this program is to compare the number of African American students who are properly diagnosed with ADHD and ASD and then placed into their appropriate service programs at the end of the first year. Then every year subsequently for the next 5 years, there will be a comparison of numbers. On a macro level, the numbers of how many African American students that receive the appropriate services in Beacon will be considered. On a meso level, the numbers of how many African American students are receiving appropriate service in the Beacon School District compared to New York City and New York State. Then on a micro level, the number of how many African American students are receiving appropriate services in Beacon at the end of 1 year as opposed to at the beginning of this past year. So we were going to be looking for the input of the parents, of the educators, and the support members. We're going to be looking for the staff involved with the program, any staff members from school. These will all be considered when there are comparisons to behavioral changes. There is constant participation in groups and workshops and weekly therapies. So there's going to be great opportunities for feedback as to which therapists and therapies are the most effective for the children with ADHD and ASD, and how many of the diagnoses are accurate. With this program, the goal is to get as many children diagnosed with ADHD and ASD that are African American. In this program is specific to the Beacon School District. And that is my presentation.